Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnameneha kihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Mapus. On this episode, I am joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. I would like to remind everyone we request you send in your COVID-19 related questions to us at podcast@mitw.org. Welcome, Vaughn.
Morning, Sheena. Having trouble with my mic. Morning.
So this week we had a new emergency order 18, that was released. Can you just talk a little bit about that? Like, has anything changed with it from the last order?
Not a ton's changed. Emergency Order 18 was kind of to bring together what we'd been talking about at Incident Command for a while, because we had, separate emergency orders about mask mandates and separate emergency orders about opening like the different tribal departments, and so we just kind of wanted to bring it all together. So Emergency Order 18 starts on July 3rd, ends August 7th right now, so they wanted to stretch it out another month, kind of to see how things would work out with some of the variants that are spreading right now. It covers all places of worship, like educational facilities, bars, restaurants, stores, farmers markets. They can all open 100% right now. They're open to sell food. All the tribal and government departments can be opened 100% for fully vaccinated employees. Right now, they're asking unvaccinated employees to continue mask using and social distancing. Where appropriate, and if approved by supervisors, they can also have unvaccinated employees work remotely and stuff, which could be the case for some of our coworkers that are immunocompromised or have family members that are immunocompromised. Tribal facilities will be open to the public, but that's by appointment only. The rec center is going to be open to fully vaccinated individuals. If you want to be able to re-enter the rec center, you'll need to contact Lucas. Is his last name pronounced Bem?
Bom.
Thanks. Sorry, Lucas. Okay. Thank you, Sheena. And you can contact Lucas at 715-799-5184. You'll just need to show him your proof of vaccination. He'll reactivate your card so you can get in. As far as other establishments, businesses and institutions and stuff, individuals don't have to use masks unless required by state or federal, local laws or rules of that organization. Caveat to that, though, face masks are still going to be required at the tribal clinic, all of the schools, the CBRF, our detention facilities, and our transit sites and on the transit vehicles, as well as the congregate sites like the meal sites, Eagle's Nest, and the DV shelter. And then we're also discontinuing the temperature screenings upon entry and stuff. So that's kind of what 18 covers in a nutshell. We released it to the public this last week. If you want, we can put that in the show notes.
Yeah, we can do that for sure. So speaking of masking, I think there's a lot of confusion at this point, because we have the World Health Organization that recommended that even fully vaccinated individuals should continue to be masking right now because of the Delta variant. So can you just clear up for us, like, should vaccinated people be masking or not at this point?
Okay, I'm going to throw out this caveat. I personally have a difficult time supporting some of the recommendations of the World Health Organization right now, because the organization produced some less than accurate information towards the beginning of the pandemic. And so some of my trust in their recommendations and their observations has waned, in my opinion. That said, I can understand why they made that recommendation. So the World Health Organization is putting out recommendations globally, not just here in the U.S. or locally here in Wisconsin. And there are several countries that are using vaccinations for the COVID vaccine that are slightly less effective than the Pfizer, Moderna, and Johnson & Johnson vaccines that we've been using here in the U.S. There have been documented cases of, entire medical staffs contracting COVID after being vaccinated for it with some of the vaccines that were developed in other countries. So part of the reason they're saying that is that there is a higher risk for individuals in other countries that haven't utilized the same vaccines we have to still contract COVID. So at this point, I can see why they would recommend that some countries still utilize, or recommend to some countries why they'd utilize the mask. For us, though, we try to follow the CDC recommendations, and that's what I would recommend that we use. They haven't been 100% perfect, but they're trying to get out the information as best they can at the speed of science. And so right now, fully vaccinated individuals, as far as the CDC is concerned, really only recommend mask usage for like public indoor locations, or low ventilation areas or situations where you're in close confines with someone that either is potentially sick or maybe unvaccinated. So as far as masking everywhere for fully vaccinated people here in the US, I'm not too concerned about that, but it's what people feel comfortable doing, so I'm not going to push that on anyone.
Yeah. So really, it's because of the type of vaccine that we have. It's not something that we should really have to be concerned about.
Yeah, we've really produced a high quality preventative measure with the vaccines here, and it's terrible. We don't have to worry quite as much as some other locations. So I feel blessed because of that and the science that we have here in the United States.
So can we expect, right now, I don't think the Delta variant's a huge concern for us locally. But if it does become a concern at some point, can we expect the tribe to kind of go back to their masking mandates of everybody being masked at all times?
Currently there's no plan to bring back the mask mandate. We do have the Delta variant on our mind. Regionally, and when I say regionally, I mean Wisconsin, Michigan, Minnesota, and Illinois, the Delta variant's making up about 5.9% of all variants out there for COVID right now. So it's not a huge thing here in like the Bemidji area. You do hear a lot about it because it's very prevalent in California and the Southwest, the Intermountain West region, Great Plains region. In some cases, it's as high as 25 to 35% of all cases they're having right now. So it's definitely moving this way. Could become a problem, but it's not currently. And so hopefully we can get more of the population vaccinated so it doesn't become a big issue.
So speaking of vaccinations, we have a lot of people that don't want to get vaccinated. That's their choice. But now we have some misinformation that people are sharing, that people who are vaccinated somehow shed these spike proteins and they can somehow affect or cause disease in unvaccinated people that are close to them. So can you just shed some light on that?
Sure. So when you get vaccinated, what that contains is the protein for your cellular machinery to produce the spike protein that COVID has. And it's what allows it to stick to cells and into the body. That said, none of the materials in the mRNA vaccine that any of the organizations are using right now contain genetic information of COVID that replicates the virus. Even if you do produce the spike and you do shed the spike, air quotes around shedding the spike, that wouldn't harm anyone because there's none of the mRNA contained within the coronavirus. And so you wouldn't be building viral particles, and you wouldn't be, what's the word I'm looking for? You wouldn't be shedding any sort of particulate that would cause infection. You could inhale the spike proteins, but as long as you don't have the viral mRNA that's inside of it, or RNA, I should say, you'd be fine. So, yeah.
Okay, so you said that you had some news about long-term effectiveness around vaccines.
Yeah.
So what was that about?
A great article came out in the journal called Nature. It's well-renowned. It's been out for 100 plus years. And one of the recent articles that was published was they found that individuals that get vaccinated with the Pfizer or the Moderna vaccines are producing B cells between 4 and 6 months after vaccination. Now that sounds weird, esoteric. If you're not into immunology, let me break down what that means. Usually when you get infected, your B cells and your immune system take particulates of the infection, whether it's bacterial or viral, back to your lymph nodes and various locations where B cells are produced, and they generate antibodies. The fact that let me back that up. Usually after you get sick, you produce those B cells and stuff for maybe, a couple months afterwards. You get a common cold, you're producing B cells and stuff for a few months. The fact that you're still producing B cells 4 months after you're vaccinated with the COVID vaccines is really positive for long-term immunity, because it means that the immune system is still actively engaged with those particles, and the longer it stays actively engaged, it will be less reliant on the memory cells in the immune system. So if it stays active longer, obviously, like we said, you'll have a longer term immunity. They're thinking because of the amount of time that the immune system stays engaged, we may not need booster shots with the Pfizer or the Moderna vaccines. So it's positive news. It's really into the weeds sometimes when you read through the papers. I'll be honest, some days it makes my head hurt, but it's great news.
Good. Well, I'm glad you can break it down for us because I would have no clue. Okay, so you also said you wanted to share some information about variants. So can you go over that?
With all the talk about variants, sometimes it gets hard to keep track of what they all are and where they're all coming from. And so there are a few variants. There are 4 of them specifically that the CDC is tracking as variants of concerns. And they all have 3 different names. So I just wanted to run through them really quick, just so you have an idea of what's going on with them. The first one is B117. That's now known as the Alpha variant. Previously, it was known as the UK variant. That was the variant that was detected back in December of 2020, and that a lot of people were concerned about. It's still the major variant out there right now in the US, as far as variants go. So now we know. B1351 is considered the beta variant. That was detected in South Africa, and they found that in January of this year. And it makes up, a relative portion of what we see right now. P1 is the Gamma variant. That was the original Brazilian variant that was also found in January. And you may hear about B16172, which is the infamous Delta variant, or the variant that was coming out of India that most people are talking about now. They found that's the one that tends to be spreading the most. This week, the Delta variant makes up about 10% of total cases nationally. Like we mentioned earlier, it's only about 5 to 6% here in the Bemidji area.
It's a wonder that everyone didn't want to use those super long, complicated names.
Right?
They're so
they just
easy to get out and
off
remember.
The tongue. Yeah.
Okay, so our next topic, you said you had some safety tips for people who are traveling this summer.
Yeah, and we've talked about them a lot, but it's been a while, and so it's always good to get a reminder. The best thing you can do at this point, if you want to stay safe and healthy during the summer, especially if you're traveling, is get vaccinated before you leave. Hands down, that's the best thing you can do. And speaking of hands, washing your hands is probably the next best thing you can do. Soap and water for at least 20 seconds. Sanitizer if you don't have soap and water. Also a great way. Keep your hands clean. Don't put them in your mouth. Don't rub your eyes. After that, wearing a mask that covers your mouth and your nose it protects others from anything that you might exhale, and also staying, at least 6 feet apart from others just helps kind of cut down on the amount of particulates we're sharing with others. And then, avoid crowded areas or poorly ventilated areas to just cut down on the potential exposure you might have.
And then you also mentioned something about community spread.
Yeah, so we talk about a lot about community spread, and so I was digging through the not archives, but a lot of the esoteric pages of the CDC, and I was like, they've got to be tracking where this is on a county level, and they do, and it's actually a fascinating page to look at. They break the entire country down by county, and they're doing some great analytics there. We should put that link in the show notes because that's a great page. I think everyone's going to be interested in that. Yeah, we definitely will. All right. But it tracks not only who's vaccinated, but also community spread. And so right now, the CDC has our county at 48.7% fully vaccinated. It's pretty good. They're saying our community spread right now is low. And what that means is we've had between 0 and 9 cases per 100,000 people. I know we don't have that many people in the county, but that's just how they have to calculate it to, have a comparison across the board. Shawano County, I've heard people worry that they're only 30% vaccinated in the county and that, they're going to be the death of us all. Good news, 40% of the county is fully vaccinated, not 30. It's a little lower than the state average, but they're still, making a good effort to try to get everyone vaccinated there. They also have low community spread right now. On the flip side, Oconto County is 47.6% fully vaccinated, but they have moderate spread, which means they have between 10 and I believe 20 people per 100,000 that have had it in the last 7 days. But Langlade County, which has 41.8% of their community fully vaccinated, has substantial spread, which means they've had between, I believe it's 20 and 30 cases per 100,000. Mm-hmm. So, yeah. So that's kind of what's going on in the community. We have
a wide variety of situations going on.
We do. And, the public health officials in all of those areas are just trying their darndest to help keep everyone healthy and safe and move us through this so we can return to a normal situation.
Sure. So, Vaughn, do you have any final message for people for the holiday weekend?
Enjoy the holiday, stay safe, be prudent about what kind of situations you put yourself in. Try to know who you're around and whether or not they've been vaccinated and the risk levels that you're going to be at. So, but other than that, enjoy your weekend, enjoy the holiday. Happy Independence Day, everyone.
Thank you, Vaughn. Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab, and keep up to date by following us on Facebook at MITW Podcast. I do weekly updates with Vaughn. We welcome any community questions you have regarding COVID-19, so please send those to us at podcast@mitw.org.